On this episode of Putting Possibility into Practice, I am joined by Brock Morris, the Chief Information Officer and Chief Marketing Communications Officer for Allegro Pediatrics. We'll talk about the practice, its background, where it's located, and what brought Brock into the healthcare space. We'll also talk about how he helped implement EHR solutions to the practice when he first joined in 2010. This is Putting Possibility into Practice, and it starts right now. I'm Joe Agustinelli, Social Media Manager at Greenway Health, and I welcome Brock Morris, Chief Information Officer and Chief Marketing Communications Officer, as I mentioned in the intro, of Allegro Pediatrics. And Brock, welcome to the podcast.
Great, thanks for having me, Joe. Appreciate it.
Talk a little bit about the practice. Where are you guys located? How big are you guys? Number of providers, and obviously pediatrics. So we're talking children's health, but some of the maybe specialties that you guys are involved with.
Sure, yeah. So we're based out of Bellevue, Washington. We're a privately owned group of pediatricians, a little over 100 pediatricians at this point, with 8 clinical locations, plus our administrative office that also houses our centralized scheduling center, IT, and other in-house services, our operations. We see on average about 200,000 patient visits a year, and so that can range anywhere from 800 to 1,200 a day, depending on a busy location. Again, just general pediatrics. So really, cradle to college is sometimes what we refer to. So right at birth, all the way up into whenever that transition of care is most important for the patient. Oftentimes that ends up being around 20 or 21 when we try to help our patients transition out into adult medicine. And what got you involved in healthcare? Did you go to school for it, or? No, so it was. It's an interesting sort of story. I had been part of an IT company that had offered solutions and services, and was brought into actually a large pediatric group in Salt Lake City, Utah. Was there delivering a software solution for them, and was approached with a need for an IT director position within their organization. So this was 15 years ago, and so I joined to help transition them from, as they were preparing for an EHR implementation, but also they had no technical infrastructure, no servers. They didn't even have a domain or weren't managed. Again, this was back in the early 2000s. So I came on and helped them sort of catapult into this age of technology, and then went on the search for an EHR, and this was back in about 2005, and then helped them to implement, and then after being with them for several years, I was approached by Allegro Pediatrics, at that time Pediatric Associates, there in Bellevue, Washington, because they had the need for the same services, somebody to direct both internal IT and also assist with the implementation of an EHR. So they had selected Greenway at that point and brought me up at the end of 2009 to prepare for their clinical implementation of Greenway. And talk a little bit about, going back, I mean, of course, a lot has changed in the 8 or 9 years. What advice would you give a practice who maybe just now is going around that route of implementing an EHR solution? Yeah, absolutely. So I think the same principles stand true now that they did then, and whether you're implementing EHR for the first time or you're going through a deinstall and putting in a new product, I think it starts at the very beginning with what I would call organizational will. So the most critical component to, I think, any major implementation, especially around software, is do you have the organizational will to have it implemented and adopted as it needs to be? And if not, I think that's an absolute stopping point, where we're then going through the process of getting the buy-in from the proper stakeholders, whether that be just the providers or their board of directors, or there's certain C-levels that need full buy-in and an understanding that it's a process and it will be painful at times. So that's sort of where we started, was absolutely having the organizational will that the ultimate importance was that this was necessary, that if we were going to continue to be viable and effective in healthcare, we needed to implement. And that if there were any of those who felt like it wasn't an important step, that they probably should consider finding another place to practice. That came from our board. And that was extremely important in buy-in throughout the entire process, especially since most of our providers are actually owners in the company, privately owned, and so having that buy-in from the beginning was essential. And then it goes into things like across the board, the training. Training is key. We thought it important that we do in-house training, so we brought out sort of the train-the-trainer approach. We allowed Greenway to come in and train our staff, but we took it from there, wrote our own training materials, and went out clinic to clinic over a 10-month period, would spend a month in a clinic helping them go live, or training them ahead of time, helping them go live, and then post go live support for each clinic was critical for our success. So even after we left that clinic, so we'd all sort of converge on a site, we'd get it implemented, and then the rest of the team would roll out to the next site. And then we always had people who owned that previous clinic. They'd come back, they'd visit them, they'd make sure their needs were taken care of so they didn't feel this great void. Obviously the technical infrastructure, it's part of what I do in some of my other hats, making sure that what you have in place is ready to support the number of users, that the performance is there. We got to a point in our implementation where we had to call a quick stop to what the path we had decided technologically, because we weren't getting the performance out of it. And so you have to be able to be nimble too, to make decisions quickly and change your trajectory, and implement what's necessary, and again have the organizational will and buy-in to invest in that. Again, that has to be successful. That's changing a little bit now with more hosted solutions, which I absolutely think is the go-forward strategy from a general software, but EHR especially. And then support, again, ongoing support beyond that. So that's a quick Reader's Digest version of our approach. It was very successful. We were on time with 100% adoption based on what our projected plan was. So it was really quite a good experience.
And is it different for a pediatric practice when you talk about number of users? Because obviously, for the most part, the users of your EHR systems, they're going to be the parents of the patients, correct rather than the patients themselves.
Yeah, if you're talking about who we're seeing, it is the parents that we're engaging with, right? And what's interesting with what might be different in that area is that there is, we now have parents who have never known the world without the internet, right? And so their expectation from a technology standpoint is much higher. The demographic we're dealing with are those who expect to have technology delivered. In fact, it becomes a sign of quality or lack thereof if you're not leveraging the right technologies. They see if you're not using technology effectively, then they see it as a lack of clinical quality, which is a very interesting experience we've had. And so absolutely, the demographic in a pediatric space is unique, I think. And then also unique from the volume that pediatrics brings, right? So our doctors are needing to see, we see in 10 and 20 minute appointment increments. And so it's very, very fast paced because that's how pediatrics and the reimbursement goes. So oftentimes 25 or 30 patients a day is necessary, or what our docs end up seeing.
And in moving forward, as technology continues to evolve, what have you heard from your docs on technology essential in the next EHR platform?
So I think as you talk about a next-gen EHR platform, it first begins with the user experience, right? So it begins with built device agnostic first, right? Where they need to be able to use it on whatever device they need in whatever location that they need to be able to access it. So I think that comes right out of the gate. Historically, a lot of EHRs don't leverage the full real estate of the device that you're on, and so you end up struggling with accessing the right information in a timely manner in the right places. So I think it starts there. I think the expectation now, especially with moving to the cloud, is security, right? And healthcare is under greater threat and attack than I think it's ever been at this point. In fact, I've seen numbers recently that it's the most targeted industry right now, and the value of what a health record brings. So from ransomware and other things, we expect, and the concerns I hear from our doctors and our board is ensuring that it's a secure environment and that we're keeping our data our data secure. So I think those two are absolutely top of mind, and then performance and interop, right? Interoperability, which is sort of the buzzword that we've been hearing a long time in the industry, and still waiting for it to really become a natural part of the EHR experience for our doctors. It's getting closer, but there's work to be done.
I want to thank Brock Morris for sharing his thoughts on this episode of Putting Possibility into Practice. Thank you for joining us. Always great to catch up.
Thank you, Joe. Appreciate it. Take care.
And for more information on Allegro Pediatrics, you can visit their website at Allegro. That's Allegro Pediatrics.com. You can also follow them. They have a great Facebook page. You can follow them on Facebook, Twitter, Instagram, their blog. You can see all the links right on their website. And for more information on the product solutions that Greenway Health offers for pediatric practices and other practices of other specialties, visit our website at www.greenwayhealth.com. This has been another episode of Putting Possibility into Practice. I thank you for listening. A reminder that you can download and subscribe to our podcast on iTunes, Google Play Music, TuneIn, Stitcher, Spotify, Libsyn, SoundCloud, and look for more platforms coming soon. For now, I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and thanks for listening to this episode of Putting Possibility into Practice, the podcast from Greenway Health.